good evening, wherever you are in the world. My name is Dr. T, Dr. Adesoye Bukola Oluwatosin, and today is another edition of Sickle Cell with Dr. T. We shall be talking about functional asplenia and sickle cell disease. What is functional asplenia? How does it relate with sickle cell disease? Yes, just like it sounds, functional asplenia is the loss of function of the spleen. And sickle cell disease can cause a spleen to lose its function. What is a spleen? A spleen is an organ in the body. What is the use of a spleen? A spleen majorly has immunological functions. It's a body protector against infections. It helps to build immunity, and this is how it does it. It clears the blood of microorganisms and damaged blood cells and old blood cells. It maintains fluid level in the body. It produces white blood cells and antibodies to fight infections. You can see the spleen has quite a number of functions. And so how does a spleen lose its function in sickle cell disease? Okay, sickle red blood cells are sticky and gel-like, unlike normal blood cells. Normal blood cells are fluidy and they move freely through the blood vessels. But sickle red blood cells are gel-like, sticky, and they obstruct the blood vessels, thereby impairing blood flow to organs. And every organ needs blood to function. The spleen is not an exception. So, if enough blood does not get to an organ, what happens is the organ begins to die. Tissue death. Ischemia, which is insufficient blood supply to the organ, can cause infarction. Infarction is tissue death. It can cause. So it starts with when insufficient blood is getting to the spleen. It begins to scare like a scar. The spleen becomes scarred. It becomes fibrotic and then begins to shrink. It begins to shrink. And when it begins to shrink, its function is impaired. There is reduced function of the spleen. It doesn't function well when the structure is changing. So it can shrink to a point where the spleen will no longer be visible. And this is when we call it autosplenectomy. When the splenectomy is the removal of the spleen. When the spleen removes itself, that's autosplenectomy. And at this point, it is not functioning at all. Loss of function of the spleen. That is what functional asplenia. And at this point, when you go for abdominal scans, you can't visualize a spleen. People with sickle cell anemia. When I say sickle cell anemia, I mean people with genotypes HBSS and sickle beta 0 thalassemia. Most of people with sickle cell anemia would have lost their spleen before the age of 7 years. Yes, sickle cell differs in severity. So some people will still have their spleen. Some will have a shrunken spleen, which is with absent or reduced function, and some will have no spleen at all at the age of 7. But people with genotypes HBSC, sickle beta plus thalassemia, because they have lesser hemoglobin S concentration, so they still get to maintain their spleen most of the time. But sometimes the spleen can become problematic. How does the spleen become problem? It can get enlarged. There's a type of crisis called splenic sequestration crisis. It is a type of sickle cell crisis. And you know what happens during this crisis? I said the spleen filters the blood of damaged cells. Yeah. What happens is that the spleen seals the sickle red blood cells as damaged blood. For people with sickle cell anemia that has like 80% to 90% of hemoglobin S, when the spleen sees that their red blood cells as damaged blood, it can trap almost everything, and trapping almost all the blood in the body will lead to circulatory shock, organ damage, death. It is a fatal complication of sickle cell disease. So it is a complication that we prefer to avoid. That is why uh, more than one episode of splenic sequestration crisis is an indication for surgical splenectomy. You'll be wondering, why will you, what is surgical splenectomy? First and foremost, is the surgical removal of the spleen. And you'll be wondering, why will doctors choose to remove the spleen if it has so much functions? You see, in medicine, we weigh the risk and benefits. Not having the spleen can cause you to be predisposed to infections. But there are ways to treat infections, there are ways to avoid infections. But having a spleen, if having a spleen is problematic and you're having splenic sequestration crisis frequently, it can kill you anytime. So you go for the lesser evil, which is the surgical splenectomy. So any warrior having a frequent splenic sequestration crisis should consider a surgical splenectomy. It is safer that way, actually. So, how do you manage without a spleen? How do you manage without such organ, which is so useful for immunity? How do you manage without a spleen? What should you do without it? I don't have a spleen. I can remember going for an abdominal scan in my early 20s, and the radiologist was busy searching for my spleen. And I told her, ma, I have sickle cell anemia, please search no more. So immediately I told her I have sickle cell anemia. She understood, okay, autosplenectomy has occurred. So this is how to prevent yourself from having frequent infections. First and foremost, immunizations. Dear parents, don't miss any vaccine for your child. Your child must be vaccinated to be protected against infections. Both children and adults must take pneumococcal vaccines to prevent pneumococcal infections. Children less than 5 years with sickle cell disease, especially those with sickle cell anemia, should be on penicillin prophylaxis to prevent pneumococcal infection. In fact, adults who have lost their spleen can also be on prophylaxis. It's not compulsory though. And as simple as this may sound, hand washing. Hand washing does a lot of magic. Wash your hands. Wash your hands often. Wash your hands before and after you eat. Wash your hands after you go to the toilet. Wash your hands after you cough, pick your nose. Wash your hands before, during, and after cooking. Wash your hands after touching a sick person. Parents should, with sickle cell warriors, should learn to wash their hands often and wash the hands of their kids often. Preferably, don't take your kids to someone that is very ill, but sometimes it's unavoidable. So take precautions. Maybe you use a mask, you wash your hands. Store your food properly. Don't eat food that is not properly cooked or that was not properly stored. Take only purified water. Another source of infection, malaria is also an infection, and even aside sickle cell disease, malaria can cause splenomegaly, enlarged spleen, all on its own. So you must, if you're living in a malaria endemic area, you must protect yourself or your child against malaria. And this is how we do it. You use malaria prophylactic drugs. A sickle cell warrior in a malaria endemic area should be on malaria prophylactic drugs unless it is contraindicated. There are insecticide treated nets to use at home against mosquitoes. You can use insecticides, fleets, that are insecticide. You can don't stay in areas with stagnant water. You should wear clothes that cover your arms, your legs to prevent mosquito bites. There are topical creams that can be used. These are ways you can prevent having infections and malaria infections in general, so that you can avoid having frequent infections. Don't play rough, don't get injuries often. Yeah, those are ways to avoid having frequent infections. I hope you now understand what functional asplenia is, what autosplenectomy is, and its relationship with sickle cell disease. And that is all for today. Thank you.